With the elbow flexed 90 degrees, palpate and mark the lateral epicondyle. Make an 8 to 10 centimeter line through the marked point. To identify the axis of forearm rotation, pronate the hand and flex the wrist. Palpate and mark the ulnar styloid, head, and the direction of the shaft. Use fluoroscopic imaging to verify proper landmark placement. Make a longitudinal incision over the center of the capitellum. Open the joint and gain access to the radial head for Kaplan's approach. Limit distal dissection to protect the radial nerve. Remove the radial head fragments. Assemble and measure them using the radial head sizing tray. Select the trial head that corresponds to the native head. Secure the bone-holding forceps just distal to the fracture line. With the forearm pronated, select the radial neck length using the neck sizing gauges. Mark the radial neck just distal to the neck sizing gauge. Then make the radial neck cut. Starting with the smallest rasp, position the hand in pronation and insert the rasp past the tuberosity in the direction of the radial styloid. This will establish the trajectory for all subsequent rasps. Insert each of the rasps up to the etched depth mark. Continue broaching until cortical bone is encountered. If the final rasp used does not fully seat to the depth mark, a twisting motion can be used to ream. With the final rasp fully seated, mark the highest spot. This is the area to plane to ensure proper seating of the prosthesis. Prepare the resected end of the radius using the planer. Spin the planer before contacting the bone surface, then advance it lightly. With the forearm pronated, confirm the final radial neck length using the neck sizing gauges. If between two lengths, always select the shortest sizing option. Select the trial stem that corresponds to the final rasp planer used. Assemble the trial head and neck by threading the two components together. Thread the handle of the neck sizing gauge into the trial head to facilitate loading onto the trial stem. Insert the trial stem into the radius until flush against the bone. Snap the trial head and neck assembly into the trial stem. Reduce the joint and assess the sizing of the trial components by manipulating the elbow through its full range of motion. Confirm a proper fit using fluoroscopy. Then remove the trial components. Then insert the radial stem implant into the canal. Insert the stem impactor laterally, then lower the handle until in line with the stem. Impact the stem until the collar seats flush against the radius. Side load the radial head implant onto the stem, then rotate it until the threads are positioned laterally. Each radial head implant is packaged with its respective lock screw. Remove the bone-holding forceps and secure the head alignment tool to the radial head. The two tines of the head alignment tool should engage the grooves of the radial head. The head alignment tool is used to control the position of the radial head. Loosely thread the lock screw into the radial head. With the head alignment tool connected to the radial head, slide the rail of the forearm axis jig into the handle until it snaps securely. Now tighten the knob on the forearm axis jig to secure the assembly in place. With the elbow flexed and the forearm in neutral, adjust and lock the distal end of the forearm axis jig to the marked fovea of the ulna. Pronate the head alignment tool approximately 30 degrees from lateral, then tighten the lock screw while providing counter torque. Use the torque indicating T-handle driver to ensure the minimal torque has been achieved. Remove the forearm axis guide assembly. Manipulate the elbow through its full range of motion to confirm final implant alignment. Confirm implant alignment one final time using fluoroscopic imaging. Repair soft tissues as needed, then close the incision.